Hello, my name is Eleftherios Kalafatis and I'm a PhD student in National Technical University of Athens. I'm going to present you our work named Artificial Intelligence-Based Procedural Content Generation in Serious Games for Health, the case of childhood obesity. It concerns a method for generating personalized content in serious games for health. The Endorse platform is a novel integrated platform that has a primary purpose of promoting self-health management in children with obesity and type 1 diabetes mellitus. The age of the participating children is between 6 and 14 years. The platform implements a multimodal approach towards self-health management, employing a mobile serious game for children and two mobile applications, one of them for the parents and the other for the healthcare professionals. The platform leverages data from smart activity trackers that the participating children are wearing, as well as subjective reports from the parents regarding the child's eating habits, weight, and various questionnaires. The healthcare professionals also provide the child's medical history biochemical assessment and take care of the child's goal setting. The platform also incorporates a recommendation system that aims to provide the users with individualized content. This content consists of two distinct parts: game missions and messages. Firstly, the recommendation system selects the game missions that are available in the endorsed series game. These missions refresh each day and their difficulty is set according to the user's performance. Secondly, the endorsed recommendation system selects messages from a pool created by the healthcare professionals. Those messages are to be displayed in the endorsed serious game and the endorsed mobile applications. The messages belong to two subcategories: educational and progress messages. Lastly, the recommendation system delivers the mobile applications with a weekly report of the child's recorded activity by the Smart Activity Tracker and its interaction with the serious game. The endorsed serious game contains a variety of educational and action missions that are available through a central lobby. As we can see in picture A, those missions are available on an in-game map and are represented by pins. In this central lobby, a meal preparation minigame is also available. As we can see in picture B, this minigame introduces the user to a lunchbox. The user places various ingredients that has collected in previous missions in the lunchbox and sets them for evaluation. They are rewarded with coins based on their ability to create a balanced meal. The coins then can be spent in avatar customization that is also available in another area of the central lobby. In picture A, top right, there is a bell that represents the place where the endorsed serious game displays messages from the recommendation system. In the endorsed serious game pre-pilot phase, 4 total missions have been included. Cross the Swords and Dive and Rise, pictures A and C respectively, are action missions. Balance Beam and Fruit Ninja, pictures B and D respectively, are educational missions. Cross the Swords places the avatar in a reflex contest against the creature. The player has to react quickly and pierce different kinds of snacks. In Dive and Rise, the player is incentivized to collect as many healthy foods as possible while controlling a swimming avatar. Balance Beam presents a narrow bridge that the avatar has to cross while maintaining balance by using a paddle. A random food appears on one side of the paddle and the player has to pick its quantity. When the player picks the correct portion as its quantity, the paddle maintains its balance. Fruit Ninja is a mission that requires the player to slice different kinds of food that follow a random parabolic path across the screen. A designated bar fills as the mission progresses, and the mission is successful if the sliced food ingredients are considered ideal snack options. The validity and efficiency of the serious game's educational and behavioral goals has been assessed and is continuously monitored by healthcare professionals. The endorsed mobile applications serve different kinds of purposes. Firstly, they host a section that displays the messages delivered to the parents by the endorsed recommendation system. The same section is also available to the healthcare professionals in order for them to assess the efficiency and validity of the delivered messages. Secondly, the applications enable the parents' communication with the healthcare professionals through a chat feature. The applications also allow parents to log their children's weekly weight and dietary options on a weekly basis. This enables the instantaneous reporting to the healthcare professionals and thus enables remote patient monitoring by the healthcare professionals, an efficient way to interact with their patients. In order for the endorsed recommendation system to provide individualized content to users and enhance user engagement, a procedural content generation technique was designed and incorporated in the platform. The technique is based on a genetic algorithm and chooses game missions to be available in the endorsed serious game and the displayed messages both in the endorsed serious game and the endorsed mobile applications. The game missions and the displayed messages are represented by genes, which in turn form chromosomes. And as we see in the picture, MGs represent the game mission genes, and RGs represent the displayed messages genes. A gene takes the value of 1 if the game mission or message is selected, and 0 if not. The number of expressed mission genes is controlled by a rule-based system to ensure that the time in front of a screen for the players is limited. Message genes are directly linked to knowledge provided by the healthcare professionals. The genetic algorithm provides the platform with its weekly content. In order to achieve that, a fitness function selects the fittest individuals, and out of them, one is randomly chosen as a representative. Parameters WX are trained based on the user interaction with the platform according to the following rules. WMG scores promote variability in missions to be played and missions where player struggles. In example, if a mission is being played constantly, it has a lower chance to appear in the future, and if a mission receives low scores from the player, then this mission has a higher chance of appearing in the future. WRG scores promote educational messages relevant to identified weaknesses and progress messages relevant to both identified weaknesses and strengths. The procedural content generation is repeated weekly. After each weekly iteration, the fittest chromosomes form pairs and produce offspring for the next generation by exchanging genes according to a random crossover point. There is also a small chance of mutations happening in order to improve the gene pool in cases of saturation. A chromosome from the resulting generation is randomly selected for the next weekly iteration and provides the platform's content. According to a rule-based system, the number of expressed genes is determined, and this rule-based system is there to set a limit on the player's screen time and also to limit the thematology and categories of the displayed messages. Validation of the procedural content generation technique was conducted in terms of user acceptance and accuracy of the delivered personalized content during the endorsed pre-pilot obesity study. The integration of this technique was evaluated in two directions: a post-intervention questionnaire and a correlation test. Part of the post-intervention questionnaire is presented on the left of this slide, and on the right we can see the correlation that was performed on data from the Fitbit activity trackers and the messages provided by the genetic algorithm. Now, moving to the results, 3 questions were selected from the post-intervention questionnaire as the most relevant according to the acceptance of the procedural content generation system, with scores signifying an overall acceptance of the generated content. Messages displayed on the platform's applications were found to be more useful than messages on the serious game, with the relevance of the messages displayed on the serious game scoring the lowest. Regarding the correlation between the generated content and the data collected from the physical activity sensors, negative correlation was observed across all investigated combinations. Negative correlation signifies that unhealthy habits in terms of physical activity, sedentary time, and sleep duration generated more educational messages from those categories, advocating towards the success of the procedural content generation technique to personalize the platform's content. Correlation between steps, physical activity, and sedentary time messages was statistically significant. All in all, taking into consideration the results that we presented in the previous slides, we can conclude the following. Answers to the post-intervention questionnaires indicate overall acceptance regarding the individualized content provided by the genetic algorithm. The negative correlations presented showed genetic algorithm sensitivity to trends regarding lifestyle and self-health management habits. The fitness functions managed to translate user trends into appropriate changes in gene weights. Furthermore, the impact of the individualized content on the users will be analyzed in future iterations of the study. This work was supported within the framework of the ENDORSE project, a comprehensive approach to empower self-management of health in children and adolescents with type 1 diabetes mellitus and/or obesity based on gamification mechanisms and biofeedback. Thank you very much for your attention.